Surgeons are expected to perform at an elite level, and yet we don't necessarily train. We don't necessarily have coaches. We don't necessarily reward or analyze those things that are important to the performance of a surgeon. Surgery is not about book knowledge. It's about how we make decisions under stress. It has to do with how we perform under pressure. And so it has very strong analogies to the athletic world, because the elite athletes have to perform under the same type of scrutiny that we do as surgeons. We don't have a coach. We don't really rehearse. We don't really warm up. We go in and perform though, but the difference of course is that athletics, they perform for entertainment. We actually perform for human suffering and to save lives. So we should be held to the same accountability standpoint that elite athletes do if we really want to pursue master surgeons. But all of the people we train, our residents, our faculty, they all have to be trained as educators. Just because they're a great surgeon doesn't mean that they're an expert educator. So there's a place where we have to start. We really have to demand that all of our educators be trained in learning technique. How do adults learn? How do we give formative feedback? How do we make our residents accountable? What's the difference between teaching, mentoring, and coaching? Each one of them has different nuances. Some of them have responsibility and accountability, and others don't. Coaches, they're not your friend. They may be friendly, but they're to get you from being a novice to an expert. They have to be able to focus your attention, understand the principles of deliberate practice, not simply repeating the same efforts over and over, but how do we expand? How do we cross-train? How do we do the things that ultimately allow us to have the next generations of surgeons who are going to take care of our children that have the same experience that we got in an apprenticeship model in a completely different world, which is what we now live in as surgeons.